Assalamualaikum warahmatullahi taala wabarakatuh. Today we from group 1 will be present about ovarian cysts. Okay, that is our group member.
So next, these are the learning outcomes that we aim to achieve through this case study. We will explore and define ovarian cysts, understand their causes, risk factor, pathophysiology, and identify clinical signs and perform proper physical and diagnostic assessments. So we'll also learn how to manage complication, formulate both actual and potential diagnosis, and finally provide health education and a holistic approach to care. So here is the table of content that we will present for our presentations. So we'll begin with the patient biography data and history, then move on to the definition, etiology, and risk factor. We will discuss the pathophysiology, clinical manifestation, and relevant examination and diagnosis tests. And then we'll then review management, present the diagnosis, and wrap up with health education and a conclusion. So for this slide, presents the biography data of our patient, Mrs. S, who is currently receiving care at Wat 10 Gynae Hospital, Kulim. She is a 28 years old female born on 5th August 1997 with the IC number 970815 and her registration number is 2500, which helps us track her clinical records accurately. So Mrs. S has been diagnosed with an ovarian cyst, which is a fluid-filled sac that develops on or in an ovary.
Okay, for the patient and family history, for the surgical history, she thought that she never had any surgery. And for the family history, she is the last of her four siblings, and her mother had diabetes mellitus and currently has a stroke on her left side body. Her father had hypertension, and both of her parents have done cataract surgery. And also, one of her siblings also suffer from ovarian cyst. For the social history, she lives with her husband, and she currently works as a packaging staff at Kulim, and her husband works as a mechanic. For the allergic history, she don't have any allergic to food or medication, and she also don't have a medical history or problem. And also, she had wear glasses for the past 10 years.
So next, let's move to definitions. So, an ovarian cyst is a small sac filled with fluid or semi-solid material that forms on or within one or both ovaries. There are different types of ovarian cysts, and most of which are painless and non-cancerous, which is benign.
Next, let's move to the ovarian cyst etiology. So, ovarian cysts can develop from several causes. Firstly, it's because of abnormal cell reproduction that may result in cystadenomas. Next is endometriosis, a condition where the endometrial tissue grows outside the uterus. Another common causes for ovarian cysts is polycystic ovary syndrome, where the multiple small cysts form due to imbalance of hormone. Lastly is pelvic inflammatory disease (PID), a severe infection of the female reproductive organs that spread to the ovaries and form the cysts.
So next is risk factor. There's a few risk factors that we can get if we have ovarian cysts. So first is hormonal problems. So fertility drugs help with ovulation, but it can also raise the risk of cysts forming on the ovaries. Second is pregnancy. After ovulation, the sac that releases the egg may grow larger and turn into a cyst. Third is endometriosis. When tissue similar to the lining of the uterus grows outside the womb, it can create cysts that called endometriomas. And then fourth is severe pelvic infection. If an infection spreads to the ovaries, it can lead to painful cysts filled with fluid or pus. And last but not least, previous ovarian cysts. So if you had a cyst before, and the body might be prone to developing the new ones in the future.
So next, let's move to the pathophysiology of ovarian cysts. So, ovarian cyst formation is often linked to the hormonal imbalance, particularly involving follicle-stimulating hormone and luteinizing hormone. Normally, this hormone regulates the ovulation process. However, when there is disruption in a follicle development, it can lead to the different types of cysts. For example, the first one is follicular cysts, formed when a follicle fails to rupture. Polycystic ovaries contain multiple cysts due to anovulation, and endometriomas result from endometrial tissue growth outside the uterus. This disruption can eventually lead to the cyst growth and potential complication like rupture or torsion.
Okay, so next we move to clinical manifestation. Okay, so the first one is pelvic pain caused by the pressure of the cyst on surrounding tissues or due to stretching of the ovarian capsule, especially during ovulation, menstruation, or physical activity. Number two, abdominal bloating or fullness. Enlarged cysts occupy space in the pelvic or abdominal cavity, leading to a sensation of fullness, pressure, or visible distension. Number three, pain during intercourse or dyspareunia. Cysts can press on pelvic organs or cause inflammation and making deep penetration painful during sexual activity. Next, irregular menstrual periods. Ovarian cysts can affect hormone regulation and ovulation, leading to changes in menstrual cycle timing, flow, and also duration. Next, difficulty emptying the bladder. Large cysts can compress the bladder or urethra, interfering with normal urine flow and making it hard to completely empty the bladder. And the last one is frequent urination. Pressure from cysts on the bladder can reduce its capacity and resulting in the need to urinate more often than usual.
Next, for physical assessment for a patient with suspected ovarian cyst, we begin with general appearance. We note any signs of pain, guarding posture, or visible distress during the movement. Next, we evaluate the vital signs. A fever might indicate infection, and tachycardia could suggest pain or internal bleeding, and low blood pressure may signal hemorrhage from a ruptured cyst. Then, during abdominal examination, we look for menstrual irregularities, observe for swelling or asymmetry, check for localized tenderness, and use precaution to detect any dullness in the lower abdomen, especially if the cyst is large.
And then for diagnostic test for laboratory test, we have six actually. First, embryonic antigen (CEA). This diagnostic test purpose is monitor the treatment and recurrence for certain cancer, especially colorectal cancer. And the result of this patient under 1.7, it is normal. Because reference range it is 0.0 until 5.0 liter. Okay, for cancer and for next cancer antigen 1 to 5, CA 1 to 5, to purpose tumor maker primarily for ovarian cancer, and this patient show her result is 94.0 ml. Is mean height because reference range just under 36.0 mil. And then lipemic or plasma or serum, it is to check for excess fat in the blood that might interfere with test results. And this patient show that no lipemia in her body. And then icteric or plasma or serum, it is to check for elevate bilirubin, jaundice indicator. And the result no icterus. And then hemolyzed plasma or serum, it is to check for red blood cell breakdown in the sample. And this patient show no hemolysis. And then we do pap smear. Okay, for diagnostic test, in diagnostic procedure, we have four: laparoscopy, hysteroscopy, vaginoscopy, and dilation, curettage, DNC. That patient present lah for this case.
Okay, so next we move to complication of ovarian cyst. Okay, so the first one is ovarian torsion. A large of heavy cyst can cause the ovary to twist around its supporting ligaments, cutting off its blood supply. So this can lead to sudden severe pelvic pain and also may result in permanent damage or loss of the ovary if it is not treated promptly. Number two, rupture of the cyst. A cyst may burst due to increased pressure, trauma, or spontaneous rupture. So this can cause sudden sharp abdominal pain, internal bleeding, and also irritation of surrounding tissues. Number three, fertility issues. Bilateral cysts can disrupt normal ovulation or damage ovarian tissue and reducing the chance of conception. Condition like endometriosis or PCOS or polycystic ovary syndrome associated with cysts can also impair fertility. Number four, infection. An ovarian cyst may become infected, especially if it is developed after pelvic inflammatory disease or cyst rupture. Infection can cause fever, pelvic pain, and the formation of abscesses. For number five, hemorrhagic cysts. Some cysts may bleed internally into themselves or into the pelvic cavity, and it is causing pelvic pain, anemia, and also hypovolemic shock in severe cases. And the last one is chronic pelvic pain. It is persistent or recurrent cysts may lead to long-term discomfort in the lower abdomen or pelvis. This can result from nerve irritation, adhesions, or ongoing pressure on pelvic organs.
Okay, now we move to the management of ovarian cysts. The first one is medical. For the medical, we do observation and monitoring. Many cysts, especially functional ones, resolve naturally within 1 to 3 menstrual cycle. Regular follow-up with ultrasound is used to monitor change. And also for the lifestyle modification, anti-inflammatory diet, stress management, and maintaining a healthy weight may help regulate hormone and reduce recurrence. Okay, for the second is management for surgical. Okay, the first procedure we can do for the ovarian cyst is laparoscopy. Minimally invasive remove of small or benign cysts. Second is laparotomy, which is open surgery for large, complex, or potentially cancerous cysts. And the last one is cystectomy, which is a removal of the cyst while preserving the ovary. Okay, now we look for the pharmacological management. The first one is hormonal therapy, which we can use birth control pills to prevent ovulation and reduce the chance of new cyst forming. Second is GnRH agonist that used for endometriotic cysts to suppress estrogen and shrink cysts. And second is pain relief, which is NSAID, for example, ibuprofen. Is used for mild to moderate discomfort. And second is acetaminophen, which is alternative for pain management if NSAID are contraindicated. Okay, and for the last one, for the management is home remedies and lifestyle support. The first one we can do heat therapy, which is heating pad can ease cramping and pelvic pain, and dietary adjustment, which is anti-inflammatory food, and magnesium-rich snack like almond may help with symptoms. And the last one is herbal therapy, is chamomile or ginger tea may offer mild relief and relaxation. Okay, now we look for the actual nursing diagnosis. We have four actual nursing diagnosis.
Okay, for first actual nursing diagnosis, we have acute pain related to pressure from ovarian cyst as evidenced by verbal reports of abdominal pain and guarding behavior. First, intervention, assess patient pain characteristic using pain scale, rational as a baseline data to guide effective pain management, and then monitor the patient's vital signs, especially blood pressure and pulse every 4 hours, because pain can lead to psychological stress and change in vitals. And okay, for next, observe for non-verbal cues such as facial grimacing, restlessness, or abdominal guarding. It is for will help we to identify pain when the patient not express it verbally, and then ensure the patient maintains a comfortable position such as lying with knees bent. For proper positioning can reduce abdominal pressure, and then promote a calm, quiet, and comfortable environment for reduce anxiety and muscle tension. And then last, educate the patient on relaxation techniques such as deep breathing exercise. This technique can help to shift their focus away from pain and promote calmness. For second, actual nursing diagnosis, impaired physical mobility related to pain during movement as evidenced by discomfort during mobilization. Okay, for third, actual nursing diagnosis, anxiety related to potential surgery as evidenced by restlessness.
Okay, for the last actual nursing diagnosis is knowledge deficit related to ovarian cysts and their management, as evidenced by patient verbalized lack of understanding about her condition. And that is our intervention and rationale.
Okay, so next we move to potential nursing diagnosis for ovarian cysts. Okay, so for potential nursing diagnosis, number one is risk for infection related to potential for this rupture or post-operative complication. So for intervention and also rationale, assess the surgical site or abdomen for redness, swelling, warmth of discharge, early detection of local infection or abscess. Number two, monitor patient vital signs, especially the temperature regularly. Rationale, if there is elevated temperature, it may indicate infection. Number three, educate the patients to practice proper hand hygiene before and after the wound care. Rationale, it is because hand hygiene is the best method of infection prevention. Number four, maintain aseptic technique during dressing changes. Rationale to prevent introduction of pathogens into wound sites. Number five, educate the patients on signs of infection such as fever, increasing pain, and foul smelling discharge. Rationale to promote early identification and treatment of infection after discharge. And the last one is promote adequate fluid intake and nutrition such as protein. Rationale to support immune function and also wound healing. Okay, for second potential nursing diagnosis, risk for impaired urinary elimination related to bladder compression from enlarged cysts, and this is our intervention and also rationale. Okay, so for number three, risk for bleeding related to rupture of the ovarian cyst, this is our intervention and also rationale. Okay, so for the last one is risk for body image disturbance related to possible ovarian removal. So this is our intervention and also rationale.
Okay, for health education, first, told the patient that we teach the patient that ovarian cysts are small fluid filled sacs on the ovaries. They are usually not dangerous but needed to be checked regularly. And then second, ask her to watch out for sudden severe belly pain, fever, vomit or heavy bleeding, and to go to the hospital if this happen. And then reminded her to come to all her follow-up doctor visits and ultrasound tests to keep track of the cyst. And then explain how to manage pain by taking the medicine the doctor gave, just the doctor gave, and using warm clothes on her belly to feel better. And then advise her to eat healthy food, exercise often, and try to keep a healthy weight to help to prevent more cysts.
Okay, now we look for the last slide, which is conclusion. In conclusion, ovarian cysts are fluid field site that commonly develop on or inside the ovaries, especially in women of reproductive age. And most are benign and resolve on their own, but some may lead to complications like pain, rupture, or torsion that's requiring surgery. Early diagnosis with pelvic exam and ultrasound is crucial for effective management. In this case, the patient presented with abdominal pain and was diagnosed with an ovarian cyst. Pain was managed well and surgery was performed without complication. Nursing care focused on pain control, mobility, emotional support, and patient education. With proper treatment and follow-up, the outlook is generally very good. Thank you. That's all from our group. Okay, then this is our reference. Thank you for your attention.